Well, hi everyone, and welcome to our session in partnership with MSD for Mothers. My name is Rebecca Root. I'm a reporter and senior associate with Devex. And today I'm joined by Sid Goyal, CEO of Nivi, which for those of you who don't know, Nivi provides individuals with on-demand health information via 3 different platforms that we'll hear a little bit more about later on, but they are Ask Nivi, Nivi Insights, and Nivi Smart Engagement. And today Sid and I will be talking about how digital tools and innovation can really empower the strengthening of mixed health systems and ultimately lead to better quality of care and capacity building. So Sid, thank you so much for joining us.
Thanks, Rebecca. It's great to be here. It's good to connect again.
Yeah, definitely. Great. Well, first of all, what do you see as the roles of digital tools and of innovation when it comes to improving quality of care and then also in achieving that larger goal of universal health coverage?
Sure. I mean, I think what we've seen in the pandemic has, really highlighted this is that digital tends to be a good way of reaching people where they are at on their health journey. I think traditional means of health systems engaging with individuals typically focuses on those people who are most ready to take up care, who know that they need something and they go to a doctor's office. I think in the markets in which we operate, and for Nivi, that means India, Kenya, Nigeria, and South Africa, but more generally in across Africa, across Southeast Asia, across South Asia. I think what you're seeing is that more and more people have a need to have a lot of questions answered before they actually formally engage with the health system, and that's why we developed Ask Nivi to help answer those questions to make informed decisions about health. And I think with the advent of the mobile phone, really as sort of that connector, a person can really get those questions answered in the means that they want through and browse the information that they want again before they formally engage with the health system. And I think what that creates is an environment where a person goes in more informed to talk with the provider that they're going to deal with and can make really intelligent decisions about their health. And on the provider side, what can happen is you can see providers being able to have a more really rich conversation with their patient, and also help them with really the services that they need, because that person's come in informed when they connect.
Yeah, absolutely. And I guess it's better to have that accurate information than having people kind of scour the internet for dodgy
Exactly.
solutions, yeah, that then come up and have them thinking they've got all sorts.
Hmm.
Um, and as you well know, sometimes or oftentimes it's the private sector that are leading on these types of solutions. And I know that the World Health Organization has recently come out with a new strategy looking at the private sector in regards to mixed health systems and UHC. But for you, where do you see the private sector fitting into this idea of digital tools and innovation?
Well, I think with respect to the private sector, I think really the private sector can serve as the bridge to both private sector facilities and the public sector as well. So I think the private sector is not just necessarily sort of a system onto itself that is running in parallel with existing public sector services. Really, I see digital as an extension of the health system, and I think private sector solutions in the digital space, because they're typically built around a business model, are looking for cost efficiencies. And when you're looking for cost efficiencies, what that means is at the end of the day, you can serve more people. And I think that goes fits well in line with sort of the WHO's core principles around UHC, population coverage, service coverage, and financial protection. If you can serve more people at a lower cost, then you're making progress towards UHC. And I think that's where the private sector can come in the digital realm. But again, I don't think that means that there's a sort of a parallel system that exists between um, uh, between the private and public sectors. It's really about the private sector helping facilitate better connections depending on where the person is, to either private sector facilities or even public sector facilities.
Great. And I know you mentioned briefly Ask Nivi. What can you tell us about that as a kind of example of that innovation and private sector engagement at play?
Sure, sure. Well, my co-founders and I really started Ask Nivi with this observation that there was this really big gap or unmet need in building a bridge between individuals and the healthcare systems that serve them. What we saw was, this big problem of information asymmetry. People don't have enough information to make informed decisions about what healthcare services they should access and where to access those healthcare services, and likewise providers don't necessarily have enough information on the health needs of the populations that they're seeking to serve. And we built AskNivi with this idea of focusing on the individual and the consumer, with a core mission of helping every individual achieve their aspirations for health.
Yeah, and I was lucky enough to actually go to Kenya and see Ask Nivi play, and it was great to see that the access that there was to information, and especially around kind of those subjects that might be seen as more taboo, like teenage
Right.
girls were able to ask questions that they felt they weren't, and they could, might not want to in
Mhm.
person. So that, yeah, it was great to see that in person. Um, but yeah, tell me a little bit more about where you see the future of health delivery going, obviously through Ask Nivi's perspective, but also just in general.
Yeah, I mean, I think if we look at where healthcare is today, typically it still involves a person going to a pharmacy or a clinic or to a hospital, depending on their need. And I think where healthcare delivery is really going in the future, and sort of the digital revolution is a real big part of that, is bringing the healthcare system to the person's home at the end of the day.
Yeah. And it sounds exciting. There's so much possibility out there. And I think maybe we're only just kind of at the beginning of that journey into digital and innovation.
I agree. I agree. I mean, I think we're closer to the starting line than the finish line. But I think there's a lot of opportunities, for diagnostics, for biologics, for biotech to really get into the mix. And we at Nivi are just excited to be part of that. I think we're riding that wave, and that sort of consumer facing, individual facing technology that we're building, we feel is a big part of that solution going forward.
And so, how were partnerships and collaboration a part of Nivi's journey?
Yeah, I mean, I think that's an important point. Is that we're not going to do this alone. Again, we talked about private sector not being a bolt on. Is really what we're building has to fit within existing health systems, and I think that's where funders like MSD for Mothers, who's funded a lot of the work that we've done, come in. Is They have a broader perspective. Funders typically have a broader perspective on what's happening in the health ecosystem more broadly. Talking about accessibility, affordability of care, and where does your solution fit in? And I think that's where um, facilitating connections with the right stakeholders in these ecosystems. It's not just enough for us to say, hey, we're going to go deploy AskNivi into this market. Facilitating those partnerships has been sort of a key value add that funders like MSD for Mothers bring in.
Well, thank you so much for sharing, a little bit about your journey and advice and your experience. Really appreciate that today.
Thank you, Rebecca. Great chatting.